So we are back with our patient, and I have washed my hands. I've identified my patient by his name and his birthday, and I'm going to do some procedures with him to make sure his abdominal area is strong enough for him to breathe on his own. First, I'm going to do his vital signs, check his heart rate, respiratory rate, breath sounds, for on the front, for on the back, two on the sides, make sure everything's clear. And we're going to check make sure he can lift his head up as well as his leg and his arms on command. So, can you lift your left arm for me? Lifted his left arm. Can you lift both legs for me? Both legs. Can you lift your head off of the pillow? So the patient is showing signs that he is able to breathe on his own. He is strong enough. So I'm going to tell my patient on what kind of vent settings I'm going to put him on and leave him in order to see if we can get this tube out. So I'm going to put you in a mode where it's going to feel like you're breathing on your own, but if you feel any distress, you let me know and we can switch you back. I'm going to put the patient on CPAP, pressure support, FO to a 40, and a respiratory rate of 10. And I'm going to sit the patient up a little bit. So first we're going to do his vital capacity test. So what that's going to imply is he's going to have to take a deep breath in and breathe out for 5 seconds and see if his vital capacity is at the range to where he can be weaned. His NIF, he's going to suck in as hard as he can and see if that number is good as well. He's going to have 3 assessments of each to make sure he's in the right capacity. So, first we're going to do a vital capacity. Alright, so I need you ignore the vent. I'm going to ask you to take a deep breath in and blow it out as hard as you can for 5 seconds. Alright, so his vital capacity was 2.1, so he did pass his vital capacity test. Then we're going to do the NIF. So I'm going to, it's basically capping off, and he's sucking up against his self. So it's like he's fighting too. So you're going to suck in, you're going to take a deep breath, blow it out, and then you're going to suck in, and we're going to see what your negative inspiratory force is. So we're going to do that. Okay, his NIF come up to negative 30, which is a pass. And the patient shows no stress. His diaphoresis is fine, it's stable. So I'm going to leave him for 45 minutes and I'm going to come back and check on him and make sure everything's fine, his vital signs are fine. Wash my hands. Chart.